And many of these new cases come from the Omicron variant. New research on nearly 80,000 Omicron cases in South Africa finds the variant causes less severe illness, especially in vaccinated adults. Debora Patta is tracking this latest surge in South Africa, where children under 12 are still not eligible for vaccines.
The lights are on and schools are out. It's South Africa's summer holiday when children should be thinking about carefree days ahead. But the rise of COVID cases amongst kids in South African hospitals is a worrying trend. Doctors on the front line put it down to high community transmission. The infections are mostly incidental, says pediatrician Dr. Gary Rubinson.
We're seeing children who are being admitted for elective surgical procedures who are testing positive. We're seeing children who have fractures and other traumas, so completely unrelated to COVID testing positive.
Vaccinologist Professor Shabir Mahdi stresses Omicron is not targeting children in a more severe way.
Certainly not. Because it is more infectious and more transmissible, you might expect a slight increase in children that develop COVID-19.
Earlier this year, the deadly Delta third wave overwhelmed South Africa's hospitals, but the devastation then might be a silver lining now. High levels of naturally induced immunity from previous infections, experts say, could be why Omicron is so far less severe.
For this particular wave, I think we would be in a much better space, and we will experience much fewer hospitalizations as well as deaths from COVID-19 compared with what we had experienced in any of the previous 3 waves.
There's cautious optimism that COVID won't ruin another holiday this year. For CBS Mornings, Debora Patta, Johannesburg.
You're right, Deborah. It's ruined a lot of holidays. We are tired, but we must remain vigilant. Thank you.